Hi, and welcome to Diabetes by the Crew. First off today, we're going to explain to you what the physiology of diabetes. Okay. Type 1 diabetes as a result of the beta cells in the pancreas not producing any insulin. As you can see right here in the bloodstream of type 1 diabetes, there's no insulin in the bloodstream. And insulin normally attaches to the insulin receptors in cells to open up an entryway for glucose. Right here, the yellow thingies, that's insulin. And it's attaching to the insulin receptors so that it can open a pathway for glucose to get into the cells and provide energy for the cell. If not, the glucose will not enter the cells and provide any energy for the cells. Instead, the glucose will stay in the bloodstream, causing high blood sugar problems, which is diabetes. The difference for type 2 diabetes is that the pancreas produces insulin, but the insulin receptors right here, are desensitized to the insulin, so the cell can't use the insulin to take in any glucose from the bloodstream, also not providing any energy for the cells. Alright.
In type 1 diabetes, symptoms develop very quickly, while in type 2 diabetes, they develop significantly slower. Some symptoms would indicate that someone has type 1 diabetes would be excessive thirst, frequent urination, constant hunger, unexplained weight loss, fatigue, blurry vision, stomach pain, nausea, vomiting, dry and itchy skin, irritability, depression, frequent recurring infections, and slow healing of cuts and bruises. Symptoms that would indicate type 2 would be all of the above, except for stomach pain, nausea, vomiting, and the dry and itchy skin. When being diagnosed with diabetes, your doctor will most likely perform tests such as the A1C, which shows your average blood sugar, or the fasting plasma glucose test, which tests your blood sugar after you've not eaten for 8 hours. If the A1C test scores for 6.5% or more, or the random plasma glucose test scores for 200 milligrams or more, it means that you have an abnormal amount of glucose in your blood, and your doctor will most likely diagnose you with diabetes. If being tested for type 1 diabetes, the most common test will be for ketones in the urine, along with A1C or the random plasma glucose test. To determine which form of diabetes someone has, your doctor will look at the glucose and insulin levels in the bloodstream.
Type 1 diabetes cannot be prevented, but type 2 can be prevented, or at least delayed with healthy eating habits and exercise. People with type 1 diabetes can help prevent or the delay of the complications by keeping their blood sugar level in a target range. Regular medical checkups are needed. If complications are treated early, the damage may be stopped, slowed, or possibly reversed. People with other health problems following diabetes, such as high blood pressure, need to treat these conditions. Also, not smoking can reduce risk. Vaccine shots can also be a prevention. In type 2 diabetes, you also have to watch how many carbs you intake and exercise daily. If you are in risk of having this disease, your doctor may prescribe you with medicine to hold it off.
Current treatment and options: taking several insulin injections every day or using an insulin pump, monitoring blood sugar levels several times a day, eating a healthy diet that spreads carbohydrates throughout the day, regular physical activity or exercise. Exercise helps the body to use insulin more efficiently. It may also lower your risk for heart and blood vessel decrease. Regular medical checkups. You will get routine screening tests and exams to watch for signs of complications, such as eye, kidney, heart, blood vessel, and nerve diseases. These treatments usually work very efficiently and significantly help patients avoid the effects of diabetes.
Complications of diabetes. If you experience any of the complications following, be sure to see your primary care physician who can help diagnose you with diabetes or help treat the complications. One of the complications is eye complications, which includes glaucoma, retinopathy, and cataracts, often causing vision loss and blindness. An ophthalmologist is a doctor who is an expert in conditions of the eyeball and can help when patients experience these complications. Foot complications also occur. Diabetes is most likely to cause the blood vessels in the feet to harden. This can cause pain in the feet and make it hard to walk, even sometimes leading to amputations. A podiatrist is an expert in treatment of disorders in the feet, ankles, and lower extremities who can help diabetes patients with foot complications. Hearing loss happens in the ears when high blood pressure damages the tiny blood vessels in the ear. Oral health complications in the mouth, such as periodontal disease, dry mouth, ulcers, tooth decay, and infections are all possible when blood sugar is out of control. Gastroparesis is when high blood pressure affects the vagus nerve responsible for stomach emptying and causes issues with the digestive system. Ketoacidosis, or DKA, is when the body doesn't have enough glucose for energy. It creates the ketones to burn the fat for energy instead. Too many ketones is poisonous and can lead to the diabetic coma and affect the liver and kidneys. Nerve damage happens in nerve fibers throughout the body and mostly occurs in the legs and feet. Symptoms include numbness and pain in limbs or even dysfunction in other body systems. This is called neuropathy. Kidney diseases can happen when the high blood sugar damages the tiny blood vessels that filter blood throughout the kidneys and cause important proteins to leak out of the blood and into the urine. Peripheral artery disease is when the blood circulation is slowed in the limbs and creates problems in legs when keeping up to demand due to lack of blood flow. Strokes can also happen on either side of the brain due to blood clots from glucose buildup. This affects movement and sensation on an entire side of the body. Lastly, stress can happen if there is too much glucose. Heart beats faster, muscle tenses, and blood pressure rises. A psychologist or psychiatrist who is an expert in mental illness and psychology can help with stress and manage depression in diabetes patients. In any of these complications, a nutritionist or dietitian can help with managing your blood sugar so it doesn't get out of control to where these complications would occur. Also, an endocrinologist, an expert in hormone levels in the body, can help diabetes patients in managing the insulin intake to control this disease better.
Life with type 1 diabetes is all about monitoring and controlling blood sugar. However, there are two options to treat the disease. There's an insulin pump, which while taking away the ability to play contact sports, lessens the responsibilities as far as checking and balancing your blood sugar, as well as more accurately adjusting the blood sugar changes. The other option is insulin shots. This requires a person to constantly monitor their blood sugar with a tester. If their blood sugar is high, then they must take a certain amount of insulin to adjust and level out their blood sugar. Diets for type 1 diabetics usually consist of healthy foods and eating consistently because that helps keep blood sugar stable. Type 2. Life with type 2 diabetes is usually characterized by hyperglycemia. In most cases, people who have the disease are adults, however it is increasing in children. Exercise is crucial to maintaining your health when you have type 2 diabetes because exercising pushes glucose out of the cells. Also, a healthy diet is essential for managing type 2 as well as type 1. Medications are usually taken to manage the disease, such as anti-diabetic medicine, statin, blood thinners, or insulin. What type of diabetes do you have?
I have type 1 diabetes.
When did you find out you had diabetes?
November 4th, 2011.
What was your reaction when you received this information?
I was shocked and I didn't think I'd be able to go through it all.
How has having diabetes changed your life?
It's changed my life a lot because I can't eat as much, or I can eat whenever I want, but I can't eat without giving insulin. So it makes me not want to eat as much.
How are the lives of a diabetic different and similar from the lives of a non-diabetic?
Well, non-diabetics can just grab something whenever and eat it without taking insulin, and they don't have to worry about that. And diabetics have to go through a process of calculating the carbs and then taking the shot for it and testing the sugar. And diabetics can eat whenever they want. Like people without diabetes, just they have to take a shot every time.
What are some daily concerns, worries, or considerations?
My blood sugar either being high or dropping low.
What do you wish you knew about diabetes before you were diagnosed?
Really just everything about it, like the responsibilities that it goes with.
What do you wish people without diabetes knew about diabetes?
That you can't control whether or not you get it if it's type 1, and you're pretty much born with the disease.
Thanks, Zach.
Oh, hey, didn't see you there. This video has covered a lot about diabetes, and I hope you learned a lot. It told you how to manage diabetes and just a life of a diabetic, and I hope you can appreciate that.